On any given day, the Bureau of Justice Statistics reports there are around 2 million people incarcerated in the U.S. I'm Tisha Powell.
And I'm Lee Zurich. The latest data also shows thousands of those inmates are dying in custody each year. Some from natural causes like chronic illness, but others due to overdose or suicide.
It's happening in local jails as well as state and federal prisons, and the fatalities oftentimes are poorly tracked. The most up-to-date nationwide totals are from 2019. In fact, a bipartisan Senate report recently found many of those deaths are going uncounted.
Reporter Heather Graff has insight into the crisis unfolding behind bars.
Plus, a new high-tech approach to inmate safety that some detention centers are trying out. The question is, will it help?
The stories are heart-wrenching.
They treated her subhuman.
And they've made headlines across the country.
She was saying, "Mom, I gotta get out of here. I'm really sick."
This woman in Missouri arrested for warrants on outstanding traffic tickets, only to then take her last breath behind bars.
And she said, "I'll call you later, Mom," and hung up the phone. It was the last time I heard from her.
And in Hawaii,
the video is difficult to watch. We have to warn you.
A suicidal struggle that went undetected inside a jail cell. We're stopping the surveillance video here due to its graphic content, but can tell you this 59-year-old mother and grandmother who took her own life was unresponsive for hours before officers found her. Next to Georgia.
They failed my brother.
And a series of disturbing deaths at the Fulton County Jail. 10 lives lost in 2023 alone.
Their duty, sworn duty, is to not only maintain order, but to also care about the safety of every single inmate.
It is a nationwide problem, and it's not a new one. Data from the Bureau of Justice Statistics shows that between 2001 and 2019, there were more than 65,000 in-custody deaths in state prisons, another 7,000 in federal prisons, and over roughly the same time frame, more than 20,000 inmate deaths in local jails, with illness, suicide, and drugs and alcohol among the leading causes of death.
All it takes is 1 second or 1 minute for something to happen.
Sheriff Jose Quiros oversees the jail in Arlington County, Virginia, where there's been 9 inmate deaths since 2015.
As the leader, I feel like I failed when something like that happens, because I know that if it was my family member, I would feel terrible.
So when he became sheriff in 2023, Quiros says he was searching for ways to improve safety within these walls.
Early February, late February, I decided to move forward with these devices.
He's talking about biometric sensors that can be worn on the wrist or ankle. They monitor an inmate's heart and respiratory rates as well as movement and are designed to immediately alert jail staff in the event of a medical emergency.
So this device is another layer of protection. We're not putting these devices on and just sitting back and waiting to hear an alarm. We're still doing our visual rounds, our security rounds. What I want to capture are those seconds and minutes in between.
Do you believe this is the future?
I believe that technology is the future.
It's technology made by a California-based company called Foresight Labs.
I have one locked on me now.
And that's their CEO, John DeFalco, showing us how the sensors work.
Imagine an Apple Watch that is locked on and tamper-proof and reading biometrics like your heart rate.
DeFalco, who lives in San Francisco, says his team saw a need, in part due to the alarming rise of fentanyl and an overdose epidemic plaguing his city and others.
So when you take someone into custody, chances are they may have drug addiction issues, makes them very physically compromised. They may have some mental health issues, so they're in this very fragile state. And you have to monitor them and watch them around the clock.
He feels that's where these sensors can help inside jails. And since 2020, Foresight Labs says it's partnered with more than 30 agencies in 17 states, seen here. DeFalco telling us results so far include 12 instances of lives saved.
The idea is that we want to avoid a single point of failure.
But the system is not without criticism.
In jails and in prisons, this is a new phenomenon.
Nicole Turner-Lee is director of the Center for Technology Innovation at the Brookings Institution in Washington, D.C., and she says it's essential these biometric sensors come with appropriate privacy protections and guidelines about how data collected from inmates will be used.
Having additional tools for correctional facilities to be able to monitor that on the health-related context makes sense. But what happens with these technologies is there's an enticement to use it for other stuff. So does the prison, when that data is collected, does it suggest that there are more overdoses? Or does it suggest a lack of health equity that is actually occurring
and who
among
determines
them?
that?
And who determines that, right?
How do detention facilities strike that balance?
I think it's important for them to be very transparent that they're deploying these programs. And most important, let's keep humans in the loop at all times.
The response from Foresight Labs is that they're already working to do exactly that.
The data is not used for any other purpose. It is offered as an opt-in. All of our agencies say, they use standard language to say, if you don't want it, you don't have to have it on you.
And in Arlington, Sheriff Quiroz said his staff has been specially trained.
Yes, you can say no, but we're going to try and talk to the person as much as possible.
They're also starting out small, with the biometric sensors launching first as a pilot program in the jail's medical unit.
If we're going to get this right, we want to do it right, because these are people's family members, brothers, sisters, loved ones, friends, our community.
A community in search of solutions and lives on the line every day. As for the price tag, Foresight Labs says its system and biometric sensors cost agencies about $1,800 per year per inmate. That would be about $3.6 billion to outfit the entire U.S. prison population. Now, to put that in perspective, according to the Bureau of Justice statistics, the U.S. government spends more than $80 billion a year on corrections and incarceration.
Meanwhile, as of 2023, members of Congress were still pressing the Department of Justice after that bipartisan Senate investigation found in 2021 alone, the DOJ failed to count at least 1,000 deaths in state and local jails.